Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I'm here to give you the overview of planning station of the OSCE. If you have not subscribed to my channel or if you are new to my channel, please consider subscribing it and press the bell icon to get more video. Planning station is a silent station and you will be given paper in this station and you have to make the care plan of the two problems. So this is the marking criteria for the planning station, and based on these 10 points you will be assessed in the exam. First one is clearly and the legibly handwrites answer. So whatever you are writing in the planning station, it should be clear and it should be legible. The second identifies two relevant nursing problems and needs. So these problems should be identified in the assessment station, and from that you have to write the two care plans. Third one is identifies aim for both problems. So you have to identify the aim for the problems. Suppose if your patient is having pain, you have to make the aim like to relieve the pain of the patient or to reduce the pain of the patient. Fourth is sets appropriate evaluation date for both problems. You have to set the appropriate evaluation date for both the problem. And this, if you are in the hospital setting, then evaluation date or time should be within the 24 hours. Or if you are in the community setting, it can be 1 week. Ensure nursing intervention are current, evidence-based or best practice. So whatever your intervention you are writing, it should be current and it should be evidence-based and it should be the best practice. 6 is uses professional terminology in care planning. So this is a silent station and there is no involvement of the patient, or you don't have to talk to the patient. So you can use the professional terminology or medical terminology. 7 is do not use abbreviation or acronyms. So you can use like news, PSQ9, must, but not all the abbreviation. 8 is ensure strict through errors, written legibility. So if you are writing something mistake or you have written something mistake, you can put a break that is acceptable in the planning station. 9 is accurately print, sign and date. So you have to write your full name, you have to put a signature and then date. 10 is acts professionally throughout the procedure in accordance with NMC 2018, the code professional standard of practice and behavior for nurses, midwives and nursing associates. So this is same for all the station, all the 10 station. So in OSCE exam, you will get this type of paper, and you'll get two paper for the both of the nursing problem or need. So in the patient detail, it's already written the name of the patient, hospital number, address, and date of birth. So you have to start from the nursing needs or nursing problems. And then here you have to write the aim of care, then the re-evaluation date, then nursing interventions. So minimum you have to write 4 nursing interventions. It should not be less than 4 nursing interventions. And then here you have to write your full name, then here you have to put your signature, and then here you have to write the exam date. Planning station is a 14-minute station within which you have to create 2 care plan, and you'll be given some scenario in the planning station and you have to read carefully, because there might be some changes in the planning station than the assessment station. For example, if your patient was in the pre-operative in the assessment station, you might get post-operative patient in the planning station. You'll be given back your assessment paper such as news or GCS or PSQ9 or MUST, whatever you have got in the assessment station. And also will be given back some discharge form or assessment booklet Well, whatever paper you have in the or you have completed in the assessment station, you will be given back in the planning station, and that will be helpful for you to complete the planning station easily. Nursing problems fall into three broad categories. First one is identification of patient experience of mental, emotional or health problem. Whatever patient experiencing in that situation, that might be one of the priority nursing problem. For example, if the patient is having pain, breathing difficulty, if the patient is experiencing anxiety, depression, that might be one of the nursing problem. Second one is a patient health risk or need or predicted need. For example, if the patient is having poor mobility or the patient is having decreased level of consciousness, there is a chances of having fall. So the patient might be in the risk of fall. If the patient is not eating properly, then there is a chances of getting malnourished, and then patient is at risk of malnutrition. If the patient is having wound and that is not taken care by the patient, there is a chances of getting infection. So these all things will come under second category. Third one is a patient inability to complete an activities of daily living independently. So if the patient is confused and patient is unable to maintain a safe environment, that might be one of the nursing problems, and that is come under the third broad category of nursing problem. Aim. Aim should state the desired outcome. It should be related to the problem. You can use the SMART mnemonics to identify or to write the aims. So S is specific. Your aim should be specific, not a general. Your aim should be direct, detailed and meaningful. Aim is measurable. Your aim should be quantifiable to track the progress or the success. For example, if your patient is having headache due to head injury and you are just writing patient pain will reduce within 24 hours, it is not possible to measure. So you have to write something that you can measure. If you will write the patient pain will reduce to 2/10 or less, that will be something you can measure by the pain scale. A is achievable. So your aim should be realistic. Your aim should be something that you can achieve. Suppose if the patient is having a headache due to head injury and the pain score is 7/10 and you are writing that pain will reduce to 0/10, that is not something that you can achieve within the 24 hours. So you have to write something that you can achieve within your time frame. R is realistic. Your aim should be relevant, realistic. T is timely. So if you're writing aim, it should be within your time frame. So usually in the hospital setting, you have to write, or your care plan should be within 24 hours. Or if it is community, it should be within 1 to 2 weeks. So if your patient is depressed and PHQ-9 score is 22, and you are writing that your patient PHQ-9 will be something like 5, that is not possible within 1 to 2 weeks. So you have to think about the time as well when you are writing the aim. Re-evaluation time and date. So this is a very important in the care plan, and you have to read carefully the scenario to get the idea about the time scale of the care plan. The evaluation time and date must be within the time scale written on the scenario for the planning. If it is within the next 24 hours, pick the time when you think all the nursing intervention will be actioned and review it then. This may be while you are on shift, or it may be for another nurse to review later on or tomorrow. Re-evaluation time and dates. It is normally a care plan for the next 24 hours if they are in the hospital. It is not a time when you will next review their observation weekly in the community. So re-evaluation time and date is something that you are going to review all the intervention, all the care that you have provided to the patient. For example, if the patient is having pain, And if you are writing, I'm going to reevaluate after half an hour after giving the medication, that is wrong. That you have to write in the intervention, not in the reevaluation time and date. Or if you're writing, I'm going to reevaluate based on the needs score, that is also wrong. So that you have to write in the nursing intervention. So reevaluation time and date is something when you are going to reevaluate or you are going to review all the nursing intervention, everything that you have given to patient. Nursing intervention, these are the recommendations put in place to reach the aim. To remind yourself, you can use the mnemonic IMATORID. Suppose we are going to write the care plan about the pain. So E is explain. You can write explain care to patient and gain consent for all the intervention. M is monitor. You can write monitor the pain score using 0 to 10 pain scale every 1 hourly. So you are going to write 2 care plan, and at least in 1 care plan there should be monitoring. If you are not writing the monitoring, then you will fail in the exam. So you have to be very careful with the monitoring things. A is assess. So assess the pain of the patient by using the PQRS stay. T is teaching. So you can write teach the patient the breathing exercise and relaxation technique to add pain relief. A is administered. So you can write administered analgesia or pain medication as prescribed and monitor effectiveness 30 minutes after administration. R is refer. You can write refer the patient to doctor and pain team if the patient pain remain uncontrolled. I is instruct. So you can write instruct the patient to use the call bell when the pain increases. D is document. You can write document all the care provided to the patient. Thank you for watching. Please like my video, subscribe to my channel if you have not subscribed yet, and press the bell icon to get more video. Keep watching, keep supporting. Thank you.